We are live, ladies and gentlemen, here in the third and fourth hour today. We are simulcasting in living video color in this multicast at prisonplanet.tv. Now, I originally set James-Delingpole up for the show, London Telegraph writer, best-selling author, to talk about a Canadian study that came out that shows how many more times likely environmentalists are to be dishonest, to rob, to steal, and how they hate their fellow man. Now, anyone who's had their SUV's tires slashed here in Austin, or had their car dealership burned down in Denver, or had their home burned down in Los Angeles, knows how vicious these people are. They're a gang of thugs who use the moral excuse of hating their fellow man as an excuse to be collectivist. And it doesn't matter if it's the head of climatology at NASA saying we want to destroy the industrialized world, people live too well in the West, there's too many people in the third world, their greenhouse gas taxes will conservatively kill 1 billion additional people in the first 10 years of implementation. That is very conservative numbers from Lord Monckton, who's scientifically broken it down. This is the facts that we're talking about, and this integrates into healthcare. But first, we're going to talk to him about healthcare because he's also written about the nightmares of government-run healthcare in England. Now, listen, I don't need to talk to Mr. Delingpole to know this. I've got Paul Watson, Steve Watson that work for us at Infowars.com, PrisonPlanet.com. One lives in London, one in Sheffield. They've, got insurance, and it's a nightmare. Everybody has to wait. Everybody gets treated like trash. But I've seen Tony Blair 3 or 4 years ago before he left office in the House of Commons during Prime Minister's questions on C-SPAN. And they were standing up giving cases of one woman waiting 18 months for a brain tumor. They reported that it was over 90% operable, means they could take it out and save her. 90% of the time she would have 100% recovery. But if you wait more than 6 months, almost 100% chance she'd die, and she did die. And Blair said, yes, that's too bad. We're working on that. He didn't even deny it. Why are Canadians coming here? Why are British coming here? Why are people from socialist nations coming here? Because free market gave us the best health care in the world. Government involvement in the last 35 years is what screwed up our health care. So we're going to get James Delingpole's take on that. His website's james-delingpole.com. He's also a best-selling author. We'll tell you all about that before he leaves us. Wrote a best-selling book on Obama, and it certainly turned out to be very, very accurate. It was released right as Obama got into office last year. But this isn't just James Delingpole saying this. This is the National Post of Canada. Here's the London Guardian. Give me a document cam shot. How going green may make you mean. Ethical consumers less likely to be kind and more likely to steal, many times more likely. And the BBC even said, the greenies are criminals. Delingpole had a tongue-in-cheek article, but very serious in the body. Greens sacrifice babies to Satan, sell grandmothers into slavery, etc. Well, remember what happened down in Latin America last month? You had a wife and husband kill themselves and then try to kill the baby because they were worried about global warming. In fact, here's a story out of the Telegraph. Liars, cheats, thieves. The terrible truth about the mean Greens. Here's another one. Are green consumers more unethical? Look, these people, you go to a grocery store, the paper bags bust on you. I've read the statistics that they actually create more acid, more pulp, more energy used. No, not that that matters. That's industry. It's renewable. The plastic is actually better, but they don't care. They will get in your face about it. These people want your house. They want your car. And if you go to Zilker Park, there's glass everywhere in Austin, just everywhere, all over the ground. Anyone that parks an SUV, it happened to us, gets it keyed. If you're lucky, normally windows locked out, tires slashed. Hey, listen, I got 3 children. I got my wife. When my parents went someplace with us a few weeks ago, all of us, all 7 of us, could ride in the car. But these little control freaks want to run our lives. Now, I'm ranting. I apologize to Delingpole. We're going to get into this coming up. But first, I wanted to get into government-run health care and what it's really like from Airstrip 1 in this 1984 system. Mr. Delingpole, good to have you with us.
Thank you for having me back, Alex. Yeah, so you want me to tell you about the British National Health Service experience? Well, it seems to me that there are 2 ways of allocating scarce resources, to do with health. And one way is to do it through the market, if you pay, then you will get service. The other way, which is what we've got here in Britain, is a form of state rationing. Now, maybe this way of allocating healthcare was appropriate immediately after the Second World War. But somehow I feel that the world has moved beyond the Second World War mentality, where you're kind of grateful for what you get, and you're happy to queue up for your rubbish service. The fact is that Britain has the lowest cancer survival rate in the G8. That in itself is a pretty grim indictment of our system. We also have, I don't know whether you follow this in America, we had the scandal of Stafford Hospital, the hospital where as many as 1,200 patients may have died because of government targets.
Oh, I saw an article last week where the guy just showed up over 3 days and died on a gurney.
Yeah, well, this sort of thing happens. At this particular hospital, patients were being left unwashed for up to a month. They were abandoned in their soiled, blood-stained sheets. The nurses weren't doing anything about it. They weren't giving them water. They weren't, the patients were crying out in pain. Now, I'm not saying that this is necessarily the common experience, that everyone suffers every time they go into a National Health Service hospital. Sometimes you do get good treatment. And, when you do, I mean, I burned my hand once, and after my 3 hours in a waiting room that made the Star Wars cantina scene look like Baywatch, eventually I got my treatment. But you do have to wait a very long time, and often the service you get is rather grudging, because you are treated as a supplicant, not as a paying customer. You are treated more or less like you don't really deserve to be there.
Well, that's what Tom Daschle 3 years ago said in his book. We've been reading the quotes where we need to be like Europe, where old people know they have a duty to die.
Yeah, the grass is always greener, isn't it? I do worry for America, because I think, okay, so you've now adopted this new Obamacare system. It's going to cost you, A, an awful lot of money, and B, the moment you give big government a say in allocating healthcare, big government also feels it suddenly has the right to tell you how you should live your life, how much you drink, how fatty your food is.
They're already saying $1,000 fines and jail time for salting your food in New York State, and I see them pushing similar things now in England.
Oh, absolutely, absolutely. We have this traffic light system now on our food in supermarkets, whereby red means dangerous, amber means treat with caution, and green means go. It's safe and low in cholesterol and stuff.
And they're setting the precedent to literally run your life and tax certain foods more. I mean, they're openly saying this.
Oh, absolutely. There is no question about it, because you see, once government starts spending money, your money, let's not forget, when government starts spending your money on healthcare, it thinks that the best way of making the service cheaper and getting better value for money is not through the actual service it provides, but by spending a fortune on advertising and measures to forcing free individuals to behaving in a way that conforms with the government's idea of health. So, abnormal behavior is not allowed anymore. You have to eat lettuce and live like a rabbit and not drink alcohol anymore, and definitely not smoke, or you won't get, you won't get the medical treatment that you paid for.
And that's why they love to collectivize things, because then they get all of the rabble that's on the dole angry at not just people with more money than them with class warfare, but now they're not just angry about the plastic bags or your big car. Now they're looking at what you're ordering.
Yeah, and of course the other thing you get is I don't know how familiar you are with this. You're going to get lots of health tourism. I mean, the number of health tourists we get from the third world coming over here, sneaking into the system, and getting treatment that they haven't paid for is it costs the British Exchequer a lot of money. So our service goes down and down and down, and you have to wait longer and longer and longer for treatment.